here today to talk about one of the most common causes of fertility related issues. One of those things is known as ovulatory dysfunction, or a problem with the way that the egg is released from the ovary. One of the obvious ways to kind of know whether or not someone may be dealing with this is when their cycles are not as predictable as they should be. I would say that most women, on average, should have cycles that are between 26 and 30 days. And when we start to kind of go outside of that range, maybe 35 days, 40 days in between, or maybe every once in a while it's even 21 days, that typically indicates that there's a problem with ovulation. The good thing about it is, for the most part, it is something that is extremely treatable and many times does not require super aggressive treatments to get there. So I want to talk about probably two of the most common causes of irregular cycles. One of them is known as polycystic ovarian disease, and the second is known as hypothalamic dysfunction. The two, although they cause problems with ovulation, are very different, and it's important to be able to differentiate the two so that way we can counsel people accordingly. Polycystic ovary is a condition really that is diagnosed by me talking to you. Essentially, it's diagnosed by an irregular cycle. Some women will have unwanted hair growth, acne, oily skin, and also we check some blood work to look for that, and sometimes we'll find some testosterone levels that are a little elevated. And last but not least, it's an ultrasound where we can see these small little cystic areas in the ovary. A lot of people get worried because they hear the term polycystic and they think automatically they're going to need a surgery. It's actually not treated surgically. It's treated medically and with some lifestyle modification. So that is very common to find. And the other common cause of fertility-related problems and ovulation issues is hypothalamic dysfunction. And that, for the most part, is a condition that we find in women that either were big-time exercisers or are currently big-time exercisers, meaning, the runners, the gymnasts, the dancers, swimmers, athletes, even people that were athletes before that don't do that anymore, or people that are very stressed, high-stress jobs. Maybe they're working the night shift and they don't get adequate sleep. All of these things that increase our stress can really influence the brain and the way that it stimulates the ovary. And these things, again, are very treatable by taking a kind of more of a natural approach to fertility, to our fertility and ovulation treatments.